Hi, I'm Dr. Trim Gibbons. Trim Gibbons from Tangerine Dental Care and Goodman Dental Care. Today we're going to talk a little bit about fractured teeth. What causes a fracture and what do you do about it? Well, there's generally a couple of reasons you fracture a tooth. One is, and probably the most common is you have decay under the part that you can't really see. You look in your mouth and you don't see any cavity, so to speak. But underneath the tooth where the decay works and starts eating away at the tooth becomes undermined. It's not strong. And when you bite down on something, it fractures a piece off. I can't tell you how many times we hear patients say, well, it wasn't bothering me, so it didn't come in. Well, generally that decay is really close to the nerve, and or it's a fairly large cavity. But if it's not hurting, a lot of times you can fix it with a filling or maybe a partial crown. But when it starts hurting, it's a little more involved, either extraction or a root canal. The other reason the tooth fractures is maybe there's a crack in it. And this happens a lot when someone has old silver fillings. The silver fillings will cause a tooth to have little cracks in it, and then you bite down on a piece of ice or popcorn kernel and it fractures. And in that case, most of the time you need to treat it with a partial crown or maybe a big filling, but generally a partial crown is the best treatment in those cases.